Hi, my name is Haley. I'm going to be your student nurse today. I'm going to shut the door and give us some privacy. I'm just going to ID your wristband. If you can state your full name and date of birth, please.
Sarah Miller, 6/24/93.
And do you have any pain today?
No.
Any allergies?
No.
Alright, and then do you know today's date?
October 4th, 2016.
And then what brought you in today?
Just a physical.
Alright, and then do you know what building you're in?
CHP.
Okay, I'm just going to go wash my hands before I touch you. Patient appears state age of 23. There's no obvious signs of illness. She is well groomed, she's clean, she's well kept. There's no slurring of the speech, no dysphagia or aphasia. She's alert and oriented ×4. The person, place, time, and situation. There's no body odor coming from the patient. The mood is appropriate for the situation. Her affect is not flat. She is not anxious. She is nice and relaxed. Alright, I'm just going to be in my initial assessment. Patient's head is normal cephalic, but I can see no visible lesions from here. I'm just going to palpate your skin. Skin is warm. There's no sweating, no cyanosis or jaundice. I don't see any edema on her arms or her legs. Her skin is nice and appropriate for ethnicity. It's same color throughout. She has no scars. There's a couple freckles, but no lesions. And if there were lesions, I would use the ABCDE method. A for asymmetry, B for border regularity, C for color, D for diameter, and E for elevation. Alright, and I'm just going to start with your eyes. So the pupils are nice and round. There's no visible discharge. The conjunctiva is nice and clear and pink, minimal redness, no discharge coming from the eyes. I'm just going to start with the pupillar light reflex. Well, first, the diameter is about 3 millimeters each. Alright, and then I'm just going to use the pupillar light reflex so that you can just stare straight ahead. Alright, pupils constrict bilaterally, and then I'm going to check for accommodation. If you can just follow my pen. Alright, pupils are equal, round, reactive to light, and accommodation. Next, I'm going to move to your mouth. So if you could open your mouth and say ah, please.
Ah.
Their inner mucosa is moist. There's no lesions that I see. Her tongue, habulosal nerve 12 is intact. The pierced pink papillae. Her tongue's not dry or crusty. It's nice and moist. The uvula is mobile. The tonsils are visible at about a 2+. The teeth are nice and white. She's not missing any teeth. There's no dentures or anything. Her gums are nice and pink. There's no retraction or bleeding. And then I'm just going to assess for your cranial nerve 5, the trigeminal, if you can close your eyes. Alright, did you feel that?
Mm-hmm.
Alright, then I'm going to assess for your facial nerve, cranial nerve 7, if you could smile and puff your cheeks and raise your eyebrows. Alright, cranial nerve 7 is intact. There's no facial drooping. Alright, and then from there I'm going to move on to your carotid arteries. I'm just going to palpate one at a time. Alright, there's a nice strong pulse. And then I'm just going to auscultate with the bell of my stethoscope for any bruits. Alright, no bruits or adventitious sounds are present. And then I'm just going to palpate your radial arteries, pulses. Alright, they're nice and strong. Bilaterally, I give them about a 2+. Then I'm going to palpate your brachial pulses. Those are nice and strong as well. I'll grade them also at about a 2+. And then I'm going to assess your nail beds. They're nice and pink and clear. There's no chipping or cracking. They're smooth. Capillary refill is about 1 to 2 seconds, nice and prompt. And then I'm going to test your grip strength. So if you could just use my fingers. Alright, grip strength is nice and strong, bilaterally. And then from there, I'm going to begin to assess your heart. I'm going to start in the aortic area, the second intercostal space, right of the sternum. Alright, then I'm going to move to the pulmonic in the left second intercostal space, left of the sternum. Then I'm going to move down to Erb's point in the third intercostal space left of the sternum. Alright, and then down to the tricuspid in the fourth intercostal space left of the sternum. And then finally to the mitral area in the fifth intercostal space left of the sternum. And here I would pause and listen to her apical pulse for 60 seconds. And then I would flip to my bell and reverse back up from the mitral all the way back up to the aortic to listen to murmurs or any adventitious sounds. And then while listening, I noticed that S1 was loudest at the apex and S2 was loudest at the base. And then from there, I'm going to listen to your lung sounds. So I'm going to listen for a full inhalation and exhalation. And I'm going to start up at the apices. So if every time you feel my stethoscope, if you would take a breath in, please. I'm going to do the Z pattern. All right, I'm going to do the same on the back. I'm going to start up at the apices. All right, and then I'm also going to listen laterally. All right. All right, the lungs were clear, both are all anteriorly, posteriorly, and laterally. I'm going to assess for costovertebral tenderness. Any pain?
No.
Any pain?
No.
All right, and the AP diameter is 1 to 2. Then I'm just gonna have you bend forward a little bit and I'm gonna check your spine. So the spine is nice and straight. There's no signs of scoliosis, no curvatures. And then I'm just gonna have you lay back and I'm gonna assess your abdomen. The belly button is midline. I don't see any scars or lesions, and if I did, I would still use the ABCDE method. The coloration is still appropriate for ethnicity. There's no moisture or anything. The stomach is nice and flat. There's no scaphoid or protruding. All right, first I'm going to auscultate for your bowel sounds. I'm going to start in the right lower quadrant where your appendix and right ovary are located. And I'm going to move up to the right upper quadrant where your liver and gallbladder are located. And over to the left upper quadrant where the stomach and spleen are located. And then finally down to the left lower quadrant where your left ovary and sigmoid colon are located. Gurgling was present in all 4 quadrants, but if gurgling was absent, then I would stop and listen to each quadrant for 5 minutes. And then I'm just gonna palpate for any tenderness. Any tenderness?
Mm-mm.
Any tenderness?
No.
Any tenderness?
No.
And then any tenderness?
No.
All right, and that concludes with the abdomen. I'm just gonna be sit up, please. And I'm just gonna check your posterior tibial pulses. All right, those are nice and equal. Bilaterally, I'd grade them at about a 1+. Then I'm gonna do your dorsalis pedis pulses. Those are also equal. I'd grade them at a 1+ as well. Then I'm going to check for capillary refill. Capillary refill is prompt. It's under 3 seconds. And then I'm just going to palpate for edema. I'll hold down for 5 seconds. All right, no pitting is present. No pitting is present. Leg as well. And then I'm just gonna have you stand up. We're gonna do a Romberg's test. I'm gonna have you have your hands at your sides, legs together, and close your eyes. I'm gonna stand behind you, and I'm just gonna time you for 20 seconds. Okay, you can open your eyes. Patient had minimal swing, but she did not step out, so the Romberg's test is negative. And then I'm just gonna have you sit back down. I'm gonna do a get up and go test. If you could just get up and walk across the room, please. And then back. All right, the patient's gait is nice and steady, no swaying, nice and smooth. I think that is it.